This conference will now be recorded.
Okay, I got a. We think alike. Valerie, the other woman who's on the call, is the coordinator of the project. I was the coordinator last year. I have now retired from employment and doing consulting. So I do some presentations for the Bakersfield ARC and some other technical stuff, but I'm not working full time anymore. So, with that, a little bit of background. For those of you who are unfamiliar or new to this, the federal government, through the Center for Medicaid and Medicare Services, CMS, um, in 2014 came out with a new set of regulations after a number of public hearings and presentations on what they called the final rule, a new set of rules for how the federal government expected services for persons with intellectual and developmental disabilities to be provided in the community. And they did this under the Home and Community Services System. And those rules originally, they gave providers 5 years in which to implement them. So they started off in March of 2014 with a finish date of 2019. When Donald Trump was elected president, his new Health and Human Services Agency director said, these are pretty complex rules, and it doesn't look like people are going to be able to meet them by 2019. So let's extend it to 2020, 21 actually, to 2021. In 2020, we had the pandemic occur, and that sort of threw everything back even greater. So the federal government came out and said, okay, let's go to March of 2023 for implementation of the new regulations. So as it stands right now, you all should be in full compliance with the regulations as of March of this year. Many of you had either myself, uh, the regional center, or the both of us working with you on helping you get your program design rewritten. And most people have now gotten their program design in and are meeting the requirements on paper. The issue is there's more to meeting the home and community-based waiver requirements than submitting a plan. They want to see that not only do you talk the talk, but that you also walk the walk, so that what you're doing in your facility, in your group home, and today's presentation is primarily for people who are in the residential services business. We have a similar presentation that we do every month that is geared more towards day services and vocational services for the services that take place outside of the home. These are more for what goes on in a residential setting, group home, family care home, a mentor family care agency type home. So that's what we're going to be discussing today. So how you implement the new rules is important. So that's what we're going to talk a little bit about. Just to give you an example of what that could mean is, one of the rules is having to do with clients having privacy in their bedrooms. And that includes having the ability to lock their door. Well, one of the evaluators from the regional center went out to a facility, and the client proudly showed her his key. Here's my key. I have a lock on my door now. And then he immediately told her that that lock was the same lock that every other door for every other resident had. So it really didn't, on paper, the provider met the rule. They put a lock on the door to give the client privacy, but in actuality, it didn't happen because that the key that they gave was key to like, and everybody could get into everybody's room. So privacy really still didn't exist in that facility. So those are the sort of things that we really want to start looking at in terms of how we are implementing our programs. Now, over the next 2 years, because Mark got a grant from October of 2023 through September of 2025, we're going to be presenting a lot of different webinars, seminars. If you need technical assistance, we'd be available to come out to your facility and work with you to try to really make sure that you are in full compliance. Now, what happens is if you're not in full compliance, we're not exactly sure yet. California, in in meeting the March 23 deadline, said to the feds, "Hey, can we have another year before you really start pushing on things?" And the feds said, "Okay, fine. You give you another year to sort of fine tune everything." But come March of 2024, you're probably going to have regular visits from either regional center, from DDS, maybe even state, I mean, federal people could be coming out to visit homes to look at, to see if you are indeed meeting these new requirements. And they'll be talking to you, be reviewing your books, be talking to your residents, and and then making decisions. Now, as it stands right now, the federal government pays for most of the clients in your home, all the clients that you have who are on Medicaid waiver, which is the bulk of the clients. I think at Kern Regional Center, uh, it's the majority of adult clients by far. They get the payment that for the services in your home, the check that you get for the taking care of providing the services and supports, the community uh, engagement, all the things that you do for that individual come from both federal dollars and state dollars. And it's about 50-50. So the federal government pays. So if let's say, for example, just hypothetical, you're getting $5,000 a month for this client. Of that money, about uh, 2,500 would be from the feds, 2,500 would be from the state of California. That being said, if the feds feel you're out of compliance and you've signed something at some point a number of years ago saying that you will be in compliance with the Medicaid waiver standards, they could say, okay, we are going to put this person on some sort of sanctions. And those could be anything from, hey, you can't get any new referrals. It could be that the feds aren't going to pay their 50% and you're only going to get 50 cents on a dollar from the state of California. It could be that they encourage the client to move to a different type of a living option. There could be a number of different options. That hasn't been finalized yet. So I'm just telling you this as that these are potential things that could occur down the line. If you're working towards meeting the rules and have got a pretty good handle on what you need to do, and are and are working with the technical assistance that both Leslie from Kern Regional Center is available, and she's an excellent resource, knows this stuff really well, or Valerie, who's also a great resource. So you've got two very seasoned, good folks available to you who are there to give you technical assistance and who aren't going to play got you. They're there to help you get to where you need to go, not to take you back. Um, Utilize them because they're available. In addition to that, we have a peer mentor, a woman by the name of Nicole Mensch, who is available to come out and speak with your clients and staff. And she presents from the perspective of a client of the regional center, who she's living independently, and she's available to come out and talk to your clients about client rights, about their use of the community, different options, vocational options, other things that so that you're not only are you working from the perspective of we as a management, as a line staff person, are trying to make this right. We're also working from the perspective of the people we serve. And so she's available as well. So there's a lot of technical assistance out there. In addition to that, these courses that we are providing for you are available. Now, coming up, starting on December 5th, which is going to be here pretty quickly, we have contracted with a group called CQL. They are a national organization that focuses on providing quality services to persons with intellectual and developmental disabilities. Um, and they have a number of courses that they provide, and we've contracted with them to be providing at least one in many months, two classes in a month. Those classes will be 4 hours long, and will be they're phenomenal. I've taken a couple, and I've been in this field 47 years, and I still learn new stuff from these folks. So, I really encourage you to do this. And these courses cost money, but you're getting them for free because the grant is picking up the cost of that. So normally this is the course that would be at least $100. They have a week-long course that we're going to be offering for 12 individuals. We're not going to offer it to the whole group. We're going to limit that one. And that one's $800 if you were to go buy it. So we're offering you training that if you go out and get it yourself, you'd be paying $100 for. Get it through us, and it is absolutely free. And you also have other providers from our local community and regional center folks and um, Bakersfield ARC folks on that webinar as well. So we can discuss things from the perspective of our community and how these rules work here in Kern County, in Greater Bakersfield, et cetera. So we are very fortunate to have that out there for us. In additionally, the feds are continually looking at these issues, and they're looking at the whole issue of clients being segregated in residential facilities, in site-based programs, et cetera, and are really pushing towards more and more about providing those services in the community. So that being said, that's a little bit of an introduction. Some of you have heard that before. For some of you, it's new, but keep it in mind. Look for we just sent out something the other day where you can register for the class on December 5th. First 40 people get into the class. We're trying to limit these classes to 40. It gets too unwieldy if you do a webinar for much more than that. Again, the screen that's up there right now talks about continuing education credit. If you're on this today and your name is not showing up as one of the people in here, please let us know. If you have more than one person in your group who's listening, we need to have their information as well. And again, at the end of this, you need to send something to Irene at Bakersfield ARC to confirm that you did benefit from this class. If you want the one continuing education credit unit, which is good for Kern Regional Center and community care licensing. Okay.
Okay. We're good
Yeah.
to go. Everyone has their names up and accounted for.
Okay. So, if you're not here, you're not here. Okay. Today we're going to talk about cultural competence. It's a controversial issue. There are some parts of this nation now where state government and certain and at the federal level where some people are saying this is not where we should be focusing. That it's not an area that we want to spend a lot of time and effort on. And some people think this is divisive. I don't, and the state of California does not. So this is not a political issue as far as we're concerned. This is a issue of being respectful to people that we're serving and trying to make the services as comfortable and as appropriate for that individual as we possibly can. So, with that little bit of editorial, I'll move on. Cultural competency care, cultural competent care includes knowledge, attitudes, and skills that support caring for people across different languages and cultures. So, if you are providing services to people here in Kern County, one of the things that's um, to know about Kern County is we are what is called a minority majority county, which means that people of color are greater in numbers than white Caucasian Anglo individuals are. So if you look at the statistics for Kern County, it is Hispanic is a primary group. Anglo, there's Filipino, there's Asian, there's uh, African American. There's a number of different groups that all live here in this community. And more than likely, if you're providing services, you have a mix within your home. So if you have a mix within your home, sometimes how people grew up, what they learned as children or adults, or what their family background is part of who they are. And you can sort of ignore it, uh, acknowledge it, embrace it. There's a number of different options. We want you to try to embrace it and to be so that that person feels comfortable, feels respected. It's an appropriate setting for that person because we're addressing what their hopes, dreams, needs, and wants are. Um, why is this important in delivering services? So that when you're working with someone in your residential facility, why is it important to think about who that person is, where they came from, what background they have, what food preferences do they have, what religion do they have, what culture do they express? Uh, Responding to demographic changes in Kern County, California, and in USA. Like I said, California is changed. I mean, uh, English primary is the number dominant language, followed by Spanish, followed by some of the Filipino dialects. So, we have a number of different languages here in Bakersfield. Um, we want to be respectful of that. Eliminate longstanding disparities in developmental services of people based on race, ethnicity, and cultural background. Now, this has been a challenge. Um, if you every year, the Department of Developmental Services publishes, a state agency, um, how services are being purchased throughout the state, and they also do it by regional center. And throughout the state, unfortunately, persons of color get less services in most categories than do Anglos. There are some exceptions and some areas where we're doing better than others. And that pertains locally in Kern County too. That if you're a person who is an adult Hispanic, you're getting less than 50 cents on a dollar spent on you of what someone who is Anglo is getting spent on their services. Now, why is that? I don't think anybody is uh, racist or purposely trying not to provide equitable services to everyone in the community. And yet we find that at times people are receiving less services than others. A lot of different factors that go into this. One interesting statistic that's out there is that if you're Anglo and, and have a member of your family who's developmentally disabled, as an adult, at some point in their life, there's about a 7 out of 10 chance that they will be placed out of their family home. So that they'll be go into a group home, a family home, a mentor type situation, supported living, some so they won't be living with their immediate family. They'll be living some sort of other living arrangement. For Hispanics, that's 4 out of 10. So there's a much greater emphasis on extended family, evidently, or I don't know the exact reason. That's my assumption. Um, that provides for them to be less likely to be placed out of home. Out of home is probably is the most expensive service. So does that make up for that? Why one group gets more money spent on them than another? And if that's the case, why should we be going back and looking at those clients who are staying with their families and saying, hey, we need to provide more services to you, because if you were to place your family member out, it would cost all this extra money. So let's support you by keeping them at home, by rewarding you with extra services, and that would be a way to make up for some of that difference. So that's it. It's a challenging situation. It's not only in developmental disability services. If you look at medical services in this country, persons of color tend not to get the same level of medical care. There is disparity in how doctor visits, lifespan is lower among some ethnic minorities than it is among Anglos. So we need to look to how we can go about creating equity in making sure that all of us receive what we need, and we're being treated equally in the process. Um, we want to improve the quality of services and client outcomes. Now, client outcomes, okay, so what are we trying to do for the person? Or if I used to, when I years ago when I worked in the system, we oftentimes talked about preventing a problem or maintaining the person at this level. But now we're talking about, okay, how do we move them forward? How do we move them to the next step? What are we trying to accomplish? So maybe you have a client in your home who is asking for greater independence and would like to be able to go to the mall uh, and do it independently. And so you work with him, her, on utilizing the Get Bus system, or the Get a Lift, or Uber, or some other way that they could get to the mall. And when we get to a point where they can independently do that and are pretty successful, and we uh, don't have a great deal of concern about their safety, because that's always another issue. There's what we call dignity of risk, which we'll talk about in another presentation. Um, that's an outcome that we've gotten to where we want to go. The person can now do this thing. So what are we trying to do to improve the quality of service, how we serve the person, and get more positive outcomes, where go to where the individual wants to be? Okay, now one of the other things that you need to do in all this, in terms of meeting cultural competency, is in California, it's in the law and regulation. And if you have, uh, if you're accredited, most residential facilities are not accredited. There's no requirement for that. But like, for example, the Bakersfield ARC, our work program is accredited, and so we have to meet certain standards. We have to show how we're providing services to all the different groups that we're providing, do regular surveys of those groups for satisfaction, do some other things to really show that the services that this person over here is receiving and the person over here receiving are similar, and the level of satisfaction is similar, and the outcomes where we're going for that person are meeting their individual needs. So the part of why it's important for service delivery too, is because it's the law. Okay, so where do we start? Um, we want to start off with knowledge. Acquiring a knowledge base of cultures in Kern County especially related to disability practices and beliefs. So, what do we know about people of different cultures and how they view disabilities? I worked for a year with a Middle Eastern group of families who had children and adults with autism. Now, in this particular culture, there was a certain amount of shame base. In other words, if you had a family member who was disabled, it was a shame on the family. Your family did something, and this is almost like a karma or something, somehow it's in response to something that you did that you have this particular individual in your family. And so that family would be more likely to hide or to downplay getting services or acknowledging the disability than maybe someone else would. So you need to know that. So if that's part of the culture, if the culture that embraces everyone and says it doesn't matter who you are, you're part of our culture, you're part of our family, you're part of our community. That's a very different way of looking at the a disability. So we really need to know what it's all about for that individual and their family. And one of the ways you do it, you ask them, ask family. You can these days you can get on the internet and pretty much find anything. So if you want to find out more about that, I'm sure it's readily available. Uh, be cognizant of the cultural base of those in your service area. Okay, so what it would for example, here in Kern County, we have a very large Hispanic community. Now, if you were to say like the Hispanic community and look at it as okay, it's all one community, you'd be wrong. There are persons who are recent immigrants. There are first generational people. There are people who have families have been in this country for many years, two, three, four generations of American with Hispanic background. So when you use the terminology, you need to be clear about where that is and what level of culture that person identifies with. So that's part of it too. Is as someone who maybe is a recent immigrant uh, would view certain things with a more cultural view of traditional country that they immigrated from, where somebody who's been here a generation, two, three, would be more of a sort of cultural to the uh, our community norm. So you need to be cognizant of that. And so, what are shared traditions and values of that group? What do people within that community value? What are their holidays? What are days they celebrate? If they do celebrate, what do they have dress or food or something that they is part of that holiday? And if so, how can you assist that person with acknowledging that and helping them if that's what they want to do? Be aware of the client's ethnicity. So when somebody comes in and you're learning about them, and especially if they have family involvement, ask and say, how can we as a facility make them feel comfortable with their background and their heritage, and what can we do in the home here to acknowledge that and to celebrate that and to make it part of what goes on here on a day-to-day basis.
Jeff, would that also include understanding their religious preferences as well?
Oh yeah, most definitely. Dante, I think I shared this last week. I worked for a year down in Los Angeles for a group that worked with the Orthodox Jewish community, and at that time, the Department of Developmental Services had a what they called uniform holiday schedule, where everybody had to take off like 11 days a year. And I approached the department, the DDS, and said, "Hey, can we substitute some of the days that are in the calendar that you put out with days that are part of our religious faith in terms of the days off that we take. And the department said, "Oh, you can't do that because the law says this day, this day, this day," and actually spelled it out: Christmas, Easter,
Right, right.
other things. So, anyways, we ended up as an organization taking 18 holidays a year because we had to take the 11 that DDS had, and then we had the 7 days that were uniquely to our faith. So,
Right.
yeah, definitely, faith is a incredibly important thing. I remember years ago going out to a facility, and the provider said, "Oh yeah, we all go to church on Sunday morning." And I said, "Oh, we go to church." I said, "Yeah." She goes, "My church." And I said, "Well, so do all the people in your facility belong to your faith?" Or your or want to go to your congregation? Well, we just do. I take that's an outing we go out on Sunday mornings. Well, in talking with the clients, there was one client who told me that they weren't really comfortable in that particular faith and would have preferred to go somewhere else. So what we did was we ended up calling uh, a local church in the area of the faith that that person preferred, that they grew up in, that was their tradition, that they wanted to practice, and said and explained to the minister what was going on, and said, "Hey, is there some way that you could have like a member of your congregation pick them up on Sunday morning, take them to the service, and then maybe bring them back in the afternoon, or make some sort of other arrangements, or have the provider drop them off. Somebody from the congregation watch them during that period of time, then the provider can come pick them up." So you really want to make accommodations for that, and faith is a excellent. That was an excellent question. Faith is very important to cultural because that's part of who we are. Um, I'll just give you another example. I, as a young adult, went to a funeral, and the person had died like 3 weeks earlier. And so here they are, the casket's out there, and it's open and everything else. And I grew up in a tradition where it was closed casket and you buried within a day or two. So it was very, very difficult for me to be at the service because it didn't feel right. So you want to try to figure out what it is that that person uh, grew up with, what they learned, and to try to respect that. Um, Avoid making typical assumptions about your client's culture. Become aware of your own biases and prejudices. So, oh, you're Hispanic, so you like tacos, right? Well, no, well, Hispanic could also be Central American, it could be Latin American, it could be Spanish, and maybe and even if they're uh, uh, originally from, or their families from Mexico, that may not be their favorite food. So you can't really just make that assumption that because that's a popular food from Mexico, that everybody who has Mexican heritage or Hispanic heritage likes it as well. So that's just an example. But you really want to be aware of your own bias and prejudice too. Um, Again, I'll use myself as an example. My father worked for in a multicultural setting. We grew up, there wasn't a lot of discourse or feelings that or teaching that anybody was any different than anyone else. But as a preteen, I remember we used to go shopping in one neighborhood, and all of a sudden, at some point, my parents said, "Well, this neighborhood has really sort of changed, and now it's more African American, and so we really can't shop here anymore." And I'm sitting there, what is it? Does that have to do with anything? The stores are still the same, but there's that attitude that you learn from the people who are important to you, that somehow this was not some place we should be because it was these other people, and we have to look at how we grew up and what some of those stereotypes that we learned as individuals are. I mean, right now, if you turn on the news, what are you hearing? That there's a huge rise in anti-Semitism, anti-Muslim. There's also a rise in anti-Asian. So a lot of people are looking at certain groups that, because of what's going on geopolitically with China and Israel and everything else, are making assumptions about the whole group. I'm not looking at individuals and as individuals and looking at their individual needs. Become aware of how cultural influences uh, individual behavior and thinking allow you to plan the best care for your clients. Awareness of the rules of interaction within a specific cultural group, such as communication patterns and customs, divisions of roles and family units, and spirituality, can help you better understand the attitude of your clients. Additionally, in some cultures, um, men and women are separated. So or as you see sometimes with in some of the Arab cultures, the women who wear the headgear, headscarves for their hair, sometimes for over their face too. That's very different. We you go to meet somebody, you put your hand out to shake their hand. You can't do that in certain cultures for a male to a female. You're not allowed to touch the opposite sex if you unless they're your immediate family. So that's a cultural issue for some folks. Where for us it's a greeting, and where we would say, and some people might feel a little almost insulted. What do you mean you won't shake my hand? Well, that's because we don't do that in my culture. So you need to try to understand how that fits in, how that's part of their family. Again, to Dante's point, spirituality, how religion comes into this whole picture, and that's something that we want to be sensitive to, so that we don't stereotype different groups. And it really does help with care. So how we provide the care to folks. That may also be an issue for someone who needs self-care, who needs assistance. And maybe they feel very strongly about, if they came from a culture where men and women are separated, they may not want somebody of the opposite sex assisting them with personal hygiene or other things. So you really need to know that and work with that individual uh, appropriately. Um, Stereotyping. Teaching meal planning includes the identification of the client's personal food history and preferences. So we want to try to, when you're doing your meal planning for your facility, and you have, let's say, 4 residents, and in that group, there's 3 different ethnic groups or backgrounds or cultures or religions. Ask the folks in that group, uh, what are your favorites, and maybe you plan your meal planning around that. So on this night you do this, and the next night you do this other culture. You try to incorporate all the different cultures. Now, on the other hand, if you have someone in your facility, let's say, for example, who is of the Islamic faith or the Orthodox Jewish faith, um, they will tell you that they don't eat anything that's ham product, so anything pork, anything shellfish. So even if you're looking at, okay, we're going to vary the menu from day to day, if you're having pork chops one night because that's someone else came from a culture where that's something that they eat regularly, that wouldn't work for those other residents who came from a background that don't eat pork product. So you really need to look at your menu and who your residents are, and try to develop a menu that's culturally sensitive to the different people in your home, and do it in a way that you're not offending anyone or providing meals that are not consistent with their faith. Um, okay, what are some of the actions that you can take? All right. Um, we're moving right along here. Practicing openness by demonstrating acceptance of difference. This means being respectful and curious about others' cultures and avoiding stereotyping and assumptions. On my last job, I worked with some folks that had that were of a faith that I was not all that familiar with. There were a couple people who worked there, so I would sit there and sometimes at lunch I would say, "Hey, listen, tell me a little bit about you know your philosophy about what do you see as an afterlife, what do you see as what you're supposed to be doing here and now, how do you worship, some of those other things, so I could learn more about their faith in a sort of non-judgmental, just asking because I wanted to be respectful to them and make sure that if they had any issues that I didn't overstep, like for example, there was an individual who didn't celebrate holidays, and I one day went to their office and said, "Okay, oh, so what are you going to do on the for the 4th of July holiday?" And then they reminded me, well, we don't celebrate holidays. Yeah. Okay, I apologize. You being flexible by demonstrating acceptance of ambiguity. This means being adaptive and comfortable with uncertainty and not expecting one right answer or solution. So sometimes when talking to people, it's not actually clear what's going on. And that's okay. We don't always necessarily need clarity. We just need to be flexible and be able to go with the flow and see what seems to be working for that individual. Humility is really important through suspension of judgment and be able to learn. This means acknowledging one's own limitations and biases and being open to feedback and new perspectives. So I like that. I like it when people tell me, "Wait a minute, Jeff, this is your thing is, you know, uh, you're looking at it one way, and there's more than one way to look at it." Or I don't view it the way you do. I think I view it very differently. My background tells me this. Just even an example, how you frame things. In Spanish, you don't say the black car, you say the car black. Well, just how you put the adjective versus the pronoun or whatever. But it's different. It's a different way of looking at things. So we want to make sure that we really are trying to understand that and be and we're not superior. Being humility means that we're human and that we don't necessarily always know, and sometimes we make boo boos, and when we do, recovering from those and working with the person and trying to show that, wait a minute, I'm sorry, I wasn't being culturally sensitive. I'll do better the next time, and work together. Being sensitive to others by appreciating cultural differences, this means recognizing and valuing the diversity in beliefs, values, norms, and behaviors of different groups and adjusting one's communication and behavior accordingly. Um, this last week, now that I'm retired, I started doing some traveling that I've been wanting to do for a number of years. So we went to New Orleans for a week. And New Orleans was originally Native American, and then the French, the Spanish, Creole, Cajun, African, Haitian, a number of groups all came and did two things. They kept their culture and they blended with the other cultures. So what you have is you have both homogeneity, where you have some of the original cultures and backgrounds in that community, but you also have heterogeneity, where people have sort of blended and come together and so. And I thought it was just a wonderful because what that meant was that the food preferences, the cultural preferences, the way you could uh, the opportunities to see the different ways that people thought, worked, felt, interacted was remarkable. And that's what we want to try to do is we want to try to be sensitive to others by appreciating their cultural differences. Hey, wait a minute, that's real. It's not like no, mine is right, you're wrong. You need to get in line with what I have to say because I'm the only way to do it. We don't want to do that. We want to say, okay, this is the way I've always done it. Now I see how you do it. And I see that there's some pluses and minuses to both what you're doing and to what I'm doing. And how do we work together to try to make this work for us here in this home? Um, yeah, there's me on the left. I'm a foodie. When it comes to different cultural foods, I I'll try anything really, basically, and that's how I raised my three adult children. We're all, let's try this. It's okay. It's from that's a Filipino food. That's a Thai food. That's a Russian food. An Ethiopian food. Let's try it. Let's see whether we like it or not. How do they eat the food? At the table, on the floor, with their hands, with silverware, with chopsticks. All the different things that have to go into that is part of learning and appreciating how other people do things. Show a spirit of adventure by showing curiosity and seeing opportunities in different situations. This means being willing to explore and experience new things and embrace challenges and risks as you learn opportunities. So there's challenges. And I went out recently to a restaurant and ordered something, and it was not edible for me. It was supposed to be really a delicacy, but it to my taste, it's probably an acquired taste, and I just hadn't acquired it yet. So that one didn't work, but it was a risk. I tried it. I learned something. Now I know if I order in that restaurant again, that's not one I'm going to go for. Um, Use a sense of humor through an ability to laugh at oneself. Like I was just laughing at what I ordered. Uh, this means being able to recognize and laugh at one's own mistakes and understanding and not taking one's too seriously. That's one of the nice things about being retired. My work is not quite as serious as it used to be because I don't. But that it's important to be able to really look at things again. That whole idea of humility. We don't have the right answer just because we were raised a certain way. We believe we have certain beliefs. There are other people out there who were raised differently and have different beliefs. And we want to be respectful of them. We want to learn about their beliefs and get an understanding. So we have a better understanding of what it is about what we cherish and what it is that they cherish and how we can work together to try to kind of find a common ground where we can work together and respect each other and work in a way that is best for the person in your home. That didn't need to be there. Okay, skills that you want to get. Learn new communication skills to simplify language for any client, regardless of primary language. So if someone has English as a second language, learning some of the language that person speaks. There's also, when we're talking about language, we also have American Sign Language too, which is a culture into itself as well. So we want to make sure we're respectful of that. If you have anybody in your facility who is deaf or hard of hearing, learning ways of communication that best allow your client to understand the plan of care. So when we're developing the IPP and our individual service plan that we're doing in our home, how do we make sure that the person understands what that plan is it's supposed to be their plan. So we're supposed to be taking information that they give us about what they want. We're then writing it down. And then once we write it down, we want to share that with the person. Okay, here's what we wrote down. What do you think of this? And make sure that they understand. Now, for depending on the individual's cognitive ability, some people will understand very well, and other people you have to sort of may need to break it down into smaller steps so that you can really share with them what it is that the plan is going to be doing with them and for them. Um, um, for example, developing cultural competence skills can involve assisting non-English speaking clients with a translator or changing the phrases and wording you use when explaining care. It also involves learning to adapt to new and different situations in a flexible way. So as we work with our clients, we want to make sure that it's their plan, that they understand it, that the plan that we've developed is consistent with who they are. So it takes into account their culture, their faith, their beliefs, their understanding, and that's all should be part of what we do. Um, and lastly, whereas human nature is inherited, we all we're all hardwired. There's certain things that we learn from day one. The ability to nurse from mom, and to early on we develop eye contact. We learn language over a period of time. There's certain things that we all learn. Uh, Individuals within all cultures vary based on different preferences, values, and experiences. So, depending on where you live, the culture that you're going to learn, the values you're going to learn, the experiences that you're going to receive are going to be different. So, we want to make sure that as we work with people, we're looking at, okay, what was their family life? Where did they grow up? What was it all about, and who were they? Somebody grew up first generation American from immigrant parents, but immigrant parents were very involved with their previous community, and 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 so a lot of the child got sort of mixed culture. They got the dominant culture here, but they also got at home. They got the culture that they grew up with, or that their parents embraced. So that can be different. Child rearing practices, different uh, groups rear children very differently. Some use more discipline. Some use more, talking. Some use the community to raise children. Some individual nuclear families. That all varies. Uh, Education. What sort of education system did the person go through? And was it our traditional special education system here, or did they come from another country, or were they involved with some other type of education? If they've ever had employment, what was that all about? And then again, finally, healthcare practices. And again, healthcare is something that varies from, and people with disabilities tend not to get, on average, the same level of health care as the general population. And on a leaving note, some of you probably noticed that I'm looking a bit grubby here. And the reason for that is that November is sometimes known as Movember, which is no shave November, uh, uh, and it's for uh, Male Prostate Cancer Awareness Month, which is one of the number one cancers in males, and is can be if caught early, treated very, very well. And what is required is regular periodic wellness screenings as part of checkups. And so one of the things that I'd like to encourage for all of my providers and for their families and for the clients we serve is that you get into wellness checkups and do what you need to do so that men you should be going in and or if you're a provider taking the men that you serve in to get regular checkups uh, consistent with what the American Cancer Society says by age and by condition. And for women, the same thing, the wellness checks, gynecological checks, other things based on age, other conditions, etc. And that way was one of the main ways we can keep our population uh, healthy and active, and so that and that we can then address some of the cultural issues as well. Okay, I'm available for a couple of minutes here. If anybody wants to unmute and ask a question or make a statement, I'm ready for it.
Thank you, Jeff, for your presentation today. This is a very
Okay, well, thank you,
important
Leslie.
topic. Yes, and
Now, go ahead.
I just wanted to add too that this is a great conversation starter for a lot of DSPs to have some conversations with individuals directly and kind of figure out just a little bit about their life and how many traditions they follow, what traditions they like. You know, it's a really good way to begin those conversations with individuals.
Mhm. Um, yeah, most definitely. We now I just in looking at the names of the people who are on this call, I see, and this may be an assumption on my part, but I see at least 3 or 4 different cultures based on the last names, if the people are consistent with their name, and so we all bring different things to the table, and that's important, and we want to celebrate that and really be part of who we are and what we do. And then okay, and so one final note: next Wednesday is our monthly webinar, and that will be on the topic of meaningful day. Meaningful day means that what we do during the day isn't just sitting around and watching TV or walking the mall or using coloring books and crayons. That what we're doing is that the services that we're providing both in our homes and in our day and vocational services are meaningful to the client, consistent with their individual planning. So we'll be doing that discussion next Wednesday. Next Wednesday will be an hour and a half from 10 to 11:30, and it'll be our monthly class. And then, like I said, coming up in December 5th, will be the first class of the life quality folks, and it'll be on person-centered planning. So, and that would be from 9 to 1, and it's a webinar. So if you can mark your calendar for that, we're ready to go. Um, uh, oh yeah, and then was that you, Valerie, that just put that out there? Or was that you, Leslie?
That
About
was
being able to
Tracy.
what's that?
That was Tracy.
Oh, Tracy. Okay. Oh, yeah. So, oh, yeah. Okay, Tracy. Yeah. And again, Tracy Mensch.
No, that's
Um,
Nicole, Renee.
I mean Nicole. I mean,
Yeah.
excuse me. Yeah, that's not Tracy. Yeah, Nicole. Nicole is available to come out to your facility as well to talk with you and to the clients in your home if you'd like, free of charge. It's part of the service that we provide, and she's an excellent resource on you know creating more community for individuals. Anyone else? Okay, well, thank you all for coming on today, and make sure you send in your 3 items to Irene to get your credit. Bye now.
Thank you.